Well, I think mental health is important. We've all got mental health. We've all got physical health, and some days it's good and some days it's less good. And we've all got mental health. I've had a lot of experience of mental ill health. I had a brother who had schizophrenia. I had a cousin who took his own life. Quite a lot of alcohol abuse in my family. And I've had some of those issues down through the years. I had a breakdown in the 1980s when I had psychosis, was hearing voices and seeing things and so forth. And I've had on and off depression, which was only really properly diagnosed maybe about almost 20 years ago now, which I used at various points, sometimes alcohol, sometimes work, kind of just, to deal with. And now I hopefully deal with it in better ways. But I think part of my message, particularly to young people, is that there's the stigma and the taboo that still exists around mental health. We've just got to get rid of it and understand that we all have mental health, and there are things that we can do for ourselves to look after it better.
I haven't had periods of mental ill health, but I have belatedly in my life come to realise that I've been living with somebody for 42 years who has had mental ill health and didn't get diagnosed until 20 years ago. So the first 20 years, I found it very, very hard to explain a lot of things about his behaviour and his mood. So I think I would really encourage the idea that people try and get a diagnosis or explore or talk about their feelings, and if they're struggling psychologically, as early as possible, because, where we wasted a lot of time before we really understood what was going on, and that did have an impact on us and on our family.
I think we think about mental health when it's going wrong. I think sometimes when we ask each other, how are you? And the stock answer is always to say, I'm fine. I think if you worry that somebody that you're close to, a friend or a family member, isn't fine, then I think without being necessarily too intrusive, it depends on the individual. I don't like it when people sense there's something wrong with me and they keep asking me about it. I find it very hard to deal with. So I think normalise the conversation. If you see somebody who's on crutches, you don't feel strange about saying, oh, how did you do that? Oh, I broke my ankle playing football. You see, if you bump into somebody and they've got a woman, say, who's completely bald, and you know that they're maybe going through treatment for cancer, and there used to be a taboo around cancer, but now we feel comfortable about having those conversations. So I think it's just about feeling comfortable about having that conversation. And I do think, most of the people on this call are young. I do think the younger generation is better than this. Our kids' generation are much better at talking about this than we were. I think that does help people. I think to be open is liberating. Part of the problem with me was when I used to deny there was a problem and just try and deal with it on my own. Whereas actually now, as soon as I feel a depression coming on, I'm very, very open about it. I tell Fiona, I tell the kids. If I'm working with people, I tell them. I've got a psychiatrist that I can phone up and have a chat. So I just think openness is the key.
Right, two thoughts really. One is about talking to your parents. I mean, as a parent, I would say that most parents of teenagers would probably like their children to talk to them more about their emotions. And often they find, young people do find that difficult, and that's totally understandable. So they might relate to their friends more who may not have the experience or the knowledge to be able to help them. And also, they're very affected by social media in a way I think that our generation doesn't fully understand. But I mean, having, writing about education a lot and being a school governor and having been a parent, although I haven't been a parent in primary school for a long time, I wish that we devoted more time in school to encourage children to talk about their feelings from a very early age, because that would normalise it more than anything. In fact, it isn't really part of the curriculum, is it? In a way that I believe it is in other countries, do make time for that. If it becomes habitual to talk about your feelings from a young age, it's not going to be so difficult as you get older when problems start to arise. So I think that emotional literacy and well-being should really be brought back into the education system in a much bigger way than it is now. There's no doubt at all we are suffering, and we're about to hit a massive mental health crisis for young people in this country without enough resources, and the impact of COVID, and now the impact of cost of living on families' lives. So it's more urgent than ever, I think. So, talking is the key, but it isn't always very easy for people who haven't got a history or feel comfortable talking about their emotions. And that's partly because in this country, we don't really encourage it.